Mr. Mandela is clearly one of the people in the world who needs no introduction, and so without further ado, I turn you over to Nelson Mandela.
Dr. Gale. Dr. Gale, members of the press and management, and staff of the Gates Foundation, we are all here because of our commitment to fighting AIDS. But we cannot win the battle against AIDS if we do not also fight TB. TB is too often a death sentence for people with AIDS. It does not have to be this way. We have known how to cure TB for more than 50 years. What we have lacked is the will and the resources to quickly diagnose people with TB and get them the treatment they need. We have also lost ground in the fight against TB in the face of a spreading AIDS epidemic. That's why the grant that the Gates Foundation is announcing to the CREATE Consortium is so critical. I hope this research will give us new weapons to fight TB in places that have been hard hit by AIDS. I also want to acknowledge and thank Mr. Winston Zulu, who has shared his experience fighting HIV and TB with you. There have been so few TB survivors who have stepped forward to share their stories. We need more advocates like Winston to tell the world about TB and the effect it has on so many millions of people. I was in jail when they took a specimen of my sputum and sent it to hospital. I was diagnosed with TB. When the reporter came back from hospital, they indicated that fortunately we sent the specimen before there were holes in the lung. It would take only about 4 months to cure the TB if I treated it correctly. I went to my friends in prison, Walter Sisulu and others, and told them that I was found to have the TB germ. There were long faces drawn. My friends objected to me sharing my personal affairs, but I consoled them and told them that the doctors and hospital staff knew about my status, and I therefore had no reason to hide this information from those close to me. I underwent treatment and was completely cured after 4 months. That was exactly the same with cancer of the prostate. I was diagnosed and informed, and I informed my family about my status. I then called the press and briefed them too. Again, after undergoing treatment and listening to the advice of my doctors, I was completely cured. In both cases, I spoke about it openly because I knew that once people were aware of the facts, they would support me. The press admired me for declaring my status, and I'm convinced that the support of my family, friends, and the public in general contributed to my healing process. The world has made defeating AIDS a top priority. This is a blessing, but TB remains ignored. Today, we are calling on the world to recognize that we can't fight AIDS unless we do much more to fight TB as well. I thank you.
We are so pleased to have you. We are honored by your presence at this briefing today. Thank you so much. Thank you to Mr. Mandela and to the Mandela Foundation for all the help in making sure that he could be here today. So Winston, I'll turn it over to you.
Good morning. Thanks very much, Helen. First of all, I think if you notice, I have gray hair, which means I'm growing old. And what I admire about Nelson Mandela is that every time he smiles, there are lines here, they look so beautiful. I think that's the good thing about getting old. When you smile, the whole face becomes lines, and I'm trying hard to reach that age, even if I'm living with HIV. And I'm alive today because I took TB drugs when many people couldn't afford to get them, when the TB drugs were not available. I've seen so many friends, and I've lost my own 4 brothers in a dozen years who have died from tuberculosis simply because they didn't get the drugs to have themselves treated. My first 2 brothers died in 1990, and they died 1 week between each other. And then in 1996, I lost another brother because the drugs were not there. And most painfully, I lost my young brother last year in March because there was a shortage of rifampicin back home. And I come from Zambia. Many people now are trying to get access to antiretroviral drugs. I think 6 million people living with HIV need antiretroviral drugs urgently. Many of these won't access them by 2005. I think we'll be lucky if we're going to put 3 million people on ARV by 2005. And many of these people will develop tuberculosis. I think maybe 50% of those who won't go on ARVs will develop tuberculosis. And if they can't get TB drugs, then by the time the ARVs will be available, they will have died. I strongly believe that if my brothers had access to TB drugs, they would be around today, and the 3 who had an HIV test probably would have access to ARVs that they would be now available, around now. I think my message is, it's difficult in many parts of the world to get ARVs, but it's not that difficult to get TB drugs. So why is there this big push for ARVs when we can't access TB drugs? And TB drugs are effective. You can prevent, you can treat, you can cure TB. It's not the same with AIDS. And I'm living with HIV, so I know the importance of accessing ARVs. But I think it doesn't make much sense to push for something that is far-fetched in many countries, leaving something that is much easier to access. And one way we can solve this problem is if the 2 programs, the TB program and the AIDS programs, worked together. At the moment, when I came to this conference, what I saw was all AIDS-related organizations organizing this conference. Why don't we have the International Union Against Tuberculosis and Lung Disease co-sponsoring this workshop? And why can't we have AIS, the International AIDS Society, and the UNAIDS co-sponsoring the Congress on tuberculosis, the IAU ATLOD conference in Paris in October. I think when we see things happening at that level, then the programs in the country will see that it doesn't make sense to have separate programs, TB program and HIV program running parallel to each other. Because for a person like me who has had TB and I'm also living with HIV, it happens in me, it happens in one person. So it's two diseases, the same patient. I'd like to thank you very much for listening. Thanks.